I'm here today with Dr. Raymond Ha, orthopedic spine surgeon who specializes in spinal deformity and minimally invasive surgery and treats patients at our USC Spine Center as well as the Verdugo Hills Hospital. Dr. Ha, you're one of the team of spine specialists who've come together to kind of create that integrated approach to spine care, and instead of working sequentially or siloed, the Spine Center kind of works together on the patient needs. Can talk a little bit about that.
Yeah, of course. I think it's something very, very unique. It's very exciting. You look at USC Spine Care maybe a decade ago, there's a couple of surgeons who kind of ran their own practices, but really, the sum of the parts are greater than each individual, and that's really kind of what our motto has been. I think, combining both the orthopedic and neurosurgery side, we have the ability to share ideas, share patients, debate, sometimes lively debate, about really how to treat the patient the best with most cutting-edge technology and to really give the best outcomes. And so that's kind of what we're all about, and we're very, very proud of it.
Well, as an academic medical center, how does that joint work between orthopedic and neurosurgery benefit our trainees?
Yeah, education is of course a really important part of our mission. We want to train surgeons, the next generation of surgeons, to perform appropriate spine care and to really have multiple viewpoints. So interestingly, we have a fellowship. We train both orthopedic and neurosurgery residents and fellows. So myself as an orthopedic surgeon, I went to fellowship, trained only with orthopedic surgeons. But here we actually have an equal mix. They all rotate around. They all see different perspectives and learn both views. And even more so, we learn from them. Maybe some of the fun and most educational times have been working with some of the neurosurgery fellows and kind of seeing how their training brings a different set of perspectives to how you take care of a patient as well.
Dr. Ha, what's the future of spine care?
It's really exciting. That's part of the reason why I went into spine, is the fact that the technological advances are happening at absolute breakneck speed. Our ability to perform surgery with less trauma to the patient, minimally invasive techniques, robotics, CT navigation, we're really raising the bar in terms of safety and reproducibility. An additional portion of that, I think, has to do with what it's going to look like when artificial intelligence and personalized medicine can be applied clinically. I think that we're getting to the point where we have very good information and analysis that allows us to take a patient's specific demographics, their condition, what their x-rays and MRIs look like, and then come up with an actual individual risk or chance of improvement and outcome, so that you can use that to counsel the patient and let them have more information to decide whether or not they want to proceed with something. So that's really exciting. I think we're really getting into the stage where that's actually being done in clinical practice, and we'll continue to develop.
It sounds like a game changer.
Yeah.
In your time even, how have you seen spine care change, and what's unique about an academic medical center and their multidisciplinary approach to spine care?
Yeah, I think the real benefit of having a center with a shared aim is our ability to work with multiple disciplines, to be able to offer something to the patient even though it's not surgery. And we take that actually to a next level. It's not that we have a good pathway, a patient doesn't need surgery, they need therapy, and we send them to our therapist. It's that we have a therapist in clinic evaluating the patient alongside me and perhaps giving some of their perspective on maybe the PT that they've received, starting some early advice for that patient, and to really kind of reassure them that they're going to be taken care of in that regard as well.
So covering kind of the whole continuum of their state in one shop, not having to answer the same questions over again, you and a physical therapist there with the patient, both providing your levels of expertise.
Exactly.
Gotcha. Got it. What was your calling, Dr. Ha? What drove you to be a doctor or be a spine surgeon?
Yeah.
Is there anything behind that you could share with us?
So my dad's a veterinarian, and I've been in kind of the hospital setting from when I was very, very young, taking care of animals and things like that. I love animals too much maybe to be a vet. It's really hard treating animals, when you really, really love animals. But, kind of a subset of that was I loved working with my hands. I loved being in the operating room setting. So I knew pretty early on that I wanted to be a surgeon. I think being able to work with your hands to treat and take care of disease is a very, very humbling thing. I mean, there's no greater privilege that we can have.
Dr. Ha, I know you're very busy because you're out there treating a lot of patients, and I just thank you so much for taking the time to visit with us and tell us about some of the unique things in the USC Spine Center.
Well, thanks, Rod, for your time. It was great talking with you, and always excited to share about what we're doing here at USC.